Hello, hello, hello. All right. How is everyone doing? This is where I test my mic. I did something different today, so I really need you to tell me how my mic sounds. Let me know. I don't want to talk to no one. So I'm going to give you a moment to respond. And if I don't hear you, I'm going to have to do so. Oh, so you can hear me. Outstanding, outstanding. All right. So I just want to say hello, hello, hello to everybody. Welcome to week 9. We've made it past week 8. Week up 1 through 8 is where we studied ICD 10-CM. So you all should have a really good understanding of ICD 10-CM at this juncture. Now we're ready to go. You all ready? But before I go anywhere, I want to say hello to some very, very important people. Mr. Sandeep, who's back here with me. Hello, 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 Ms. Mills. I saw Ms. Haley pop through. Come on through. And I want to say hello to our interns. I see Miss Beth, Miss Star Wars girl. She's always here early. Let's see, who else do I see? I don't want to miss anyone. Miss Mills, please let me know if I missed someone. But welcome, welcome, welcome on behalf of the team to week 9. Just like weeks 1 through 8, the purpose of these classes is not really to instruct, but today we're going to do a little instruction. In fact, I want to have an adult conversation with you. I want to hold, or we all want to hold you accountable. We want to kind of guide you along and keep you on task and pace. Also, we want to review what you should already know. We want to give you tips on how to navigate your course and finally point out any key guidelines and gems. Gems are guidelines, not all gems, but a lot of them are. Just thought I would tell you that. All right, so just want to remind you that this is not the AMCI MCDC course. So if you're an AMCI MCDC student, definitely come through. You are welcome to come in, but this is not the MCDC course. This is the YouTube course. And we meet every week, same time, same place. And if you are registered for this course, you will get weekly emails, not to bombard you with, sales or anything like that. We don't do that. Only once a year. But no, we generally don't do it. We want to just keep you looped in. So, if there's handouts or anything that you need to have or reminders, that's what we're going to do once a week. Also, want to remind you to attend. Now you can come to the Friday CPT guidelines mastery classes taught by Mr. Sandeep. This is where we go. He walks you through those scenarios, whereas we don't do that here. We have a different type of discussion, but Friday, same time, that's where you'll get this. Well, and also too, he's talking about the same subjects, right? All right. So hi, Walla. Hello. Hi, Kathy. Hi, Joey. Hi, Jackie, Yvonne, Afril, Aja. I'm saying it wrong. Sorry about that. DC Kicks. I see you. All right. So I'll shout out more people. Hi, Jane. All right. So just also want to remind you to go to IMTAP, which is Interactive Medical Terminology and Anatomy and Physiology. It's a fun way to study medical terminology and anatomy. You don't even need books, so definitely go. And also, the 2026 MCG is available. It's an ebook. The hardback is still in process. And if you have not, if this is your first time here and you haven't registered for the YouTube course, go to our website, www.amcicoding.com, click on that YouTube course, and get signed up. Yeah, click at that enrollment form and then the syllabus. Download your syllabus and you're good. All right. So just want to let you know that we have new RSVP links and this is from your syllabus. So if you want to come to class, all you do is click the link. Right now we're on week 9. In fact, you can just kind of click them all, RSVP for all classes. All right. And when you click the RSVP button, you'll come here. So if you click week 9, you will come here. It would look like this. And then on the bottom left, you'll see this little bell. That's how you RSVP. Very, very simple, and you'll get the reminder. Also, while you're at it, like Miss Leslie says, go ahead and like up this video while you're at it. If you're on your computer, please and thank you, like it up. And also to get notified of any of our uploads that is for the general population, click that. And if you are a bronze or higher, you'll get some additional lectures. All right, so textbooks. All right, last time we were using ICD-10-CM. Now, weeks 9 through 16, we're going to use the following. We're going to use the CPT Professional by AMA. We're going to use the HCPCS Level II. Any publisher is fine. And the AMCI MCG. These are the main ones. And also there is the bucks. You know, you'll definitely need the bucks, but at minimum, you just need your CPT Professional and HCPCS Level II at minimum. All right. Okay, and that is on your syllabus. Also, we've been telling people to join Discord, but you don't have to. You do not have to, and there is a cost. It is for the minimum package, it's $2.99 per month, and that's your bronze package. Now, why join Discord? Well, there are various levels of benefits or perks, but to join Discord at the basic level, you'll get additional resources like handouts and things like that. Also, you'll get access to AMCI instructors and interns. That's huge, huge. So I think the instructors, someone correct me. Mr. Sandeep, let me know, are the instructors only for gold and silver? I'm not sure. Could be for everybody. I'm not sure. But the interns are there, and a lot of them are very, very helpful and very, very sharp. Now, you can also attend the private classes like the test taking techniques class, the I'm Top class, and Friday Night Live, all in Discord. So you can access it from the syllabus. Also, last time, the last, 3 or 4 sessions, I talked about how to make flashcards with your MCG manual. I'm not going to review that because it's not pertinent for today. So I just kind of want to move on. Yeah, and get to the good stuff. All right. So from your syllabus, you should have already completed week 9. Now, I want you to type in the chat and let me know, have you completed all 7 of these steps or items? All right, so Mr. Sandeep told me that you can get access to the instructors if you are silver, gold, or platinum. Platinum is MCDC if you didn't know, because it's not even up there. So MCDC students are platinum. All right, so Lucky did the work. Good. Hi, Zoma. How are you? All right, so keep going and just let me know if you've done it, because what it'll do is it will tell me the pace that I need to go and how I need to be speaking to you. So, and if you haven't, it's okay. It's okay. We'll work it out, right? All right, so you should have done these 7. And just want to point out that the playbacks from the previous session, which is the full 16-week course, you can find it here. And you can also find the playbacks from this session on your playlist, and I'll show you how to recognize them. All right. So the green, when it's green like that, that's a playback, just so you know. All right, so this is what your playlist looks like. And when you see this purple and green, this is the playback from this class. And we're going to put them where they belong. So they're not 100% where they belong all the time. And if we haven't gotten to it, you'll see them at the very bottom. So we organize it once a week, or we try to. Hi, Jane. How are you? So just want to also remind you that when you get on this playlist, it is very easy to kind of get stuck and not go back to the syllabus. So always remember to reference the syllabus. That's going to be the tool that you use to guide you. All right, even though it's very easy to think that it's the playlist, but it's the syllabus. All right, so we've seen the syllabus, the seven steps or the seven items. Now, if you are a gold course member, you have a course like an LMS, a learning management system, which essentially manages your learning. So, you'll see all of the elements in your LMS. And no, this is not the MCDC course, and it is not the MCD course content. No, the YouTube course is pretty much YouTube videos. However, MCDC, they have their own private videos, and they do have some YouTube, but majority, about 85%, are private. We kind of walk them through a little more. All right, week 9, we're here. So what should you know? What should you already know? If you have questions, go ahead and put them in the chat. But in week 9, we're going to talk about modifiers and HCPCS Level II codes. So at this juncture, you should already know how to apply general coding HCPCS Level II guidelines and general coding modifiers guidelines. Yeah, modifiers have guidelines surrounding them. Absolutely. You should be familiar with the most common modifiers, and you should be familiar with the layout of the HCPCS Level 2 manual. Yeah, you should I'm not saying know things in order, but just know where some key things are. It'll make things easier, when you're trying to quickly access the content. All right, now it's time to test your knowledge. I want to know what you already know about modifiers. So, of course, we got true and false questions. Okay, true or false? Modifier 25 is appended to any code to indicate that a significant, separately identifiable E&M service is performed on the same date as another service. True or false? What say you? Okay, good job. I see those answers coming through. And the answer is false. That's right. Faith Project said, no, it's false because this modifier 25 is appended to only E&M codes, not any codes. Yeah. And you know what? When you all nail that, it's going to give you an advantage. I promise you. And I'm going to demonstrate that in a minute. Great job, everyone. Hi, Brenda. Brenda said, I'm here. I know that's right. Hi, Letty, Letty Ray. Hello. Hi, B. Frazier. Hi, Kalish. How are you? All right, true or false? Modifier 59 is used to indicate that two procedures were performed together as part of the same service and should be bundled. True or false? What say you? All right, I'm going to pick it up just a little bit. You guys are answering really good. We do have quite a few people here, so I'd like to see more. And don't not put your answer in there. Put it in there because I do have a bit of a delay. So go ahead, put it in there. And the answer is false. It just requires you to kind of read a little more forensically. So no apologies through the chat. Don't apologize. We were there. It's just, just being a little forensic. So this modifier 59 is used to indicate that two procedures were performed together as part of the same service. You know what? No, 59 is part of a distinct service, typically different. So maybe different lesion, different wound, different body part, typically. But if you go to Appendix B to read the definitions, or A, I'm not sure, A or B, um, it will give you more clarification. Yeah, that's right, Star Wars Girl. She said, great job, coders. I know that's right. All right, good job, everyone. If you had an aha moment, outstanding, outstanding, outstanding. Yeah. All right, true or false? Modifier 51 is used to indicate that multiple procedures were performed during the same operative session by the same provider. True or false? All right, someone said they're working. Definitely. Just listen. Don't. Hopefully, I'm not distracting you, but I'm glad you're here. All right, those answers are coming through. That's what I'm talking about. Hi, Joey. I think I said hello, but I want to make sure. Hi, Francois. Okay, Delicia. Hello, hello, hello. And they are all coming through. Everybody's saying the same thing. They're saying, well, look, what is that? What is this false? That's true, everybody. The green is true. Sorry about that. That's when you recycle things. Sorry about that. It's true. Keyword, same operative session by the same provider. Outstanding. I hope I didn't do the same thing here. All right, true or false? HCPCS Level II modifier LT indicates a procedure, service, or supply that was performed on the left side of the body, while modifier RT indicates the right side of the body. True or false? What say you? And everyone is saying true, 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 true. And the answer is true. Outstanding. All right, here's the final one. When coding for ambulances, you must append a two-character modifier. The first character represents the patient origin, and the second character represents the destination. True or false? Hi, Crystal. Hi, Ceci. Hi, Daisy. All right. Everyone is coming through, and they're all saying true. Yeah. Hi, Let. Hi, Corian. Everybody's saying true. That is true. And I'm glad you all know that. And if you didn't know that, are we going to talk about it today? No, we're not really going to talk about it today. But we can. We can. And also, I believe we have a playback on it. So it's time to review. But first, I want to talk about a few gems. And not really a few gems, it's just one with a few items on it. So these modifiers, as I've said earlier, have guidelines associated with them. So I think that if you can recognize these modifiers 22, 25, 50, 51, 52, and 59 and understand how to use them when you're taking your medical coding exam, it will indeed give you a time advantage. Absolutely. You'll be able to solve scenarios. a lot of times with the modifiers, a lot of times, or not necessarily solve, you can eliminate incorrect answers with by modifiers. So now we're going to have a discussion, and we're going to have an adult discussion. This is not, oh, modifier 25 means this, modifier 59 means this. This discussion is, there's a presumption that you kind of know what these modifiers mean. I'm not going to leave you hanging and not tell you, but I want to go a little further because I want to help you learn and really apply these modifiers. So, we're going to talk about some essential modifiers that you should know when you're taking the medical coding exam. But I do want to point out that modifiers, whether it's a CPT modifier or a HCPCS Level II modifier, you can use them interchangeably. You can use CPT modifiers on HCPCS Level II codes, and you can use HCPCS Level II modifiers on CPT codes. And I got a question for you. If you had to put your hand on your modifiers, your CPT modifiers, where would you find your CPT modifiers? Type in the chat. Where's your CPT modifiers? Really quickly. Like, where are you going to look when you take your exam? Absolutely. Absolutely. I hope everybody answers this question because I need you to know where it is. Good job. Good job. Everybody that's coming through is saying where it is. And indeed, it's in the inside cover, the front cover. That's where you'll see your modifiers. And that's where you'll need to reference when you're taking your exams. All right. And to tell the difference, a CPT modifier are two numbers, and a HCPCS Level II modifier is at least one of the characters is a letter. Okay? All right. So just thought I would tell you that. And I got a question for you. Are you all familiar, anyone in here familiar with physical status modifiers, like for anesthesia? Type in the chat. So physical status modifiers are modifiers that describes the status of the patient. If the patient is healthy, it's a P1. If they have chronic illnesses, multiple chronic illnesses, P2. If they're deceased, that's P5. Or is it P6? I'm not sure. But so for the people that know what physical status modifiers are, where would you go to look up a physical status modifier? Would you open up your CPT manual and go to Appendix A? Or would you look in your HCPCS Level II manual and go to Appendix B? Where would you look it up? Look up the definition. Somebody said, hey, I'm going to the guidelines. I know that's right. So someone said they would go to Appendix A in CPT. And someone said they go to anesthesia section. And they are there. But what type of modifier is it? Is it a HCPCS Level II modifier or is it a CPT modifier? That's where I'm getting. That's my main question. Is it a HCPCS Level II or is it a CPT modifier? Okay, but I told you that CPT modifiers have two numbers. HCPCS Level II has at least one letter. So it is a HCPCS Level II modifier. You can find them in both places, but it's a HCPCS Level II modifier, and that you'll find the definition in Appendix B of HCPCS Level II. All right, so just thought I would ask you that question because I just want to get you thinking about knowing the differences between the two. Now, I want to just kind of approach this conversation with a different way to understand CPT modifiers, right? So essentially, since we have studied a little bit, we know that there are classifications of modifiers. In other words, they kind of all work for specific purposes. For instance, when you want to alter an evaluation and management visit, you're going to use these three modifiers, modifier 24, 25, and 57. And earlier we had a question about modifier 25. This is used when there is a significant and separate E&M service. So these 25 modifier goes on E&M codes. This 24 modifier is an unrelated E&M service by the same physician in the post-operative period, but it goes on an E&M code. And so too does decision for surgery, modifier 57. This goes on an E&M code. This is the modifier for the decision for surgery. Now, we could talk further and have more conversation about it, but the main thing that I want to drive home is that these only go on E&M codes, right? So, and here, if you want to kind of study, here's the gem. Use 25 for distinct procedures on the same day, but you don't put this on the procedure, you put it on the E&M code, okay? And use 24 for unrelated visits in the global period. And 57, decision of for surgery. And the reason we need a decision for surgery modifier is because typically if an E&M visit occurs on the date of surgery, then that 57 modifier enables payment of that E&M visit. And 25 is more specific. And we're going to kind of demonstrate that. Now, also, when procedure changes, there are modifiers for that. Modifier 22, 52, and 53. When it's 22, that means that that procedure became more complex. It was more difficult. When it was 52, it was less difficult, so decreased service. And 53 means that that procedure was discontinued. And there's your cheat sheet. And don't confuse 52 and 53. Don't confuse them. One is stopping, one is decreased. All right. Now, when it involves multiple procedures, you've got bilateral, modifier 50, 51, multiple procedures, and 59, distinct procedures. These all involve multiple procedures. So you have to have more than one procedure. Now, bilateral, you only use one code, but the other two, you're going to need multiple codes. Why are you saying that, Mrs. J? I'm just saying it. It's going to be applicable soon. Now, I want to just talk to you about the global period. I want to know, do you all really understand the global period? Does anybody need does everybody kind of understand the concept? And you could go ahead and do that, and I'm going to continue. But the global period is the period that CMS says this if for this procedure, this particular procedure, this is the period that you can receive treatment for that procedure. If you fracture your leg, there's one code, and that one code will be valid for a period of 60 or 90 days. Let's say 90 days, right? And anything within that global period will be bundled. It's bundled. So any visit or things that's related to that fracture treatment, it's bundled generally. However, modifiers enable you to unbundle some things, not because you're doing it for anything that's not ethical. You're doing it because it is granted. It is allowed. So the global period means that that code is covering everything, and generally everything that all the treatment and visits surrounding that um, injury, illness, whatever is bundled. Now, when a patient has a baby, there is what we call this surgical package. That surgical package is a global code too. When a person has a baby, that code includes, whenever they deliver, that delivery code includes the delivery, the prenatal care, and the postnatal care. All right? So whenever you have a global code like that, often that code is used by one doctor. So if you have an obstetrician carries out the prenatal, postnatal, and the delivery, then that doctor can bill that one code. However, when, let's say, the doctor doesn't carry out all of those items, then you'll need these modifiers to tell the story. If a patient goes on vacation, let's say they're well to do, they're on vacation for the entire summer, the woman gives birth while on vacation, and of course her OB is not on vacation with her, so she goes to the hospital, the doctor on call delivers the baby. The doctor will often, well, if there's no specific code, but in CPT we have our own codes specifically for it. But if there were no codes, if we had to just use the global code, we would use the global code. We would append 54 to it. If the doctor did the post-op, you would do the same, the global code with that. So maybe that wasn't the best example, but you all get the picture. If it's a global surgery code, these items can pull out and enable the doctor to get paid for their particular role in that global period. So here you go. And we used to give that example, but the codes now are specific. So you don't need these modifiers. But you get the point, right? Yep. Someone said they think of the global code as a part of a bundle. Yeah, it's a package. It's a bundle. Absolutely. Very good. All right, so let's talk about global period still. We're still in that global period, and the patient returns to the OR or returns for some type of treatment. We have 58 modifiers, 78 and 79. The difference between 58 and 78, one is staged or related. The 78 is unplanned. So 58 is planned, 78 is unplanned to the OR. And yeah, the doctor sometimes is entitled to that reimbursement because every situation is not the same. It's not standard. And 79 is an unrelated procedure. Sometimes you have to put that modifier on to let the computer know that, hey, this is not related to the original procedure. So don't bundle it. Now here's your gem. Always look for those keywords in the chart or documentation. The keyword for modifier 58 is planned visit to the OR. 78 is unplanned, like a complication. And 79, this is something completely different. All right, someone said my voice is from the two lives are overlapping. Please explain that. Is my voice okay today? Okay, got it. Mr. Sandeep said that you probably should just read what Mr. Sandeep says. He said, please use either the mobile live option or the desktop live option. Only one, because you might have both. All right, Ms. Mills, is my sound okay? All right. Thank you. Thank you. All right, I'll continue. All right, so now when we're talking about surgical teams, that's more than one physician. You've got modifier 62, 66, and then you've got these assistant surgeons, modifier 80, 81, 82, and then the physician assistant or nurse practitioner or clinical nurse. Um, so these all are related to more than one doctor, and each have their own purpose. Now, make sure you know what I say. You don't have to know them all. I would just really focus on these two surgeons, know the difference, and these assistant and minimum and 82 is for a resident. Excuse me. 82 is when a qualified resident is unavailable. Excuse me. And there you go. And 66 is your surgical team. Anesthesia variations. All right. So for CPT, and if you didn't realize, we're only talking about CPT modifiers, we have 23 and 47. Is it 47? Yeah, that is 47. I have to check because you never know. Um, I really want to hone in on 47, but 23 is unusual anesthesia. You use this whenever typically anesthesia, general anesthesia, is not used for certain circumstances. So if a patient has, um, let's say they're getting something simple, let's say they're getting ear waxed removed, and they had to give this patient general anesthesia for that. This 23 modifier says that, like, hey, we know this is not common, but we had to put this patient under. So that's how you use 23. And 47, this is anesthesia by a surgeon. Now, coders, the key is this is general anesthesia by a surgeon, not just, topical or anything like that. This is general anesthesia. Sometimes that surgeon has to administer that. Yeah, typically anesthesiologists would administer the anesthesia, but when a surgeon does, you'll use a surgery code and append modifier 47. So I hope that makes sense. Now, same day, when the procedure takes place on the same day, you've got 76 modifier and 77. 76 is the repeat procedure by the same physician. That's on the same day. And 77 is repeating the procedure by another provider or different excuse me, repeat procedure by another provider, repeat on the same day by a different procedure. So this 77 can be on a different day or different provider. So 77 is different. Now, administrative and patient exceptions. You know what? I just think this is just a general title, but 26 modifiers under here, 33 modifier, 32 and 63. They have nothing in common, but these are commonly seen modifiers when you're taking the medical coding exam. So definitely make yourself familiar. We know what 26 modifier is all day, right? Yeah. Remember, we are having an adult conversation. We're not going in depth. All right, so Path and Labs got some key Modifiers 91. This is your repeat clinical diagnostic lab, very common. And 92, alternative lab platform testing. And you'll see this whenever people or providers carry out labs in the office. That's an alternative lab platform. Now, anatomic specificity. This is just basically laterality. And you'll see the E1 through E4, those are your eyelids. This F1, F9 fingers, T1 and T9, you should be able to recognize that on site that these are your toes. But LT and RT, this is left and right laterality. So these are pretty standard, right? And these are HCPCS Level II modifiers. They're not CPT, but often used with CPT codes. Now, this is, to me, the best part of this discussion. This is the best thing that I think I got out of this. We got a new cheat sheet. Yeah. And I just think it's just good to have while you're training. Like, look, E&M, here's your common E&M codes. And you can relabel this. If altered doesn't make sense to you, like if something changed about the procedure, it's 22, 52, and 53. If there are multiple procedures, 50, 51, surgical packages, post-op, teams, anesthesia, repeat, etc. I love this. And I printed this out for you. So team, if someone can go to the my notes of this presentation and give them the handout, please. And don't worry if you don't get it. We'll give it to you at the end of the session. And if you have the gold course, it's in your course. If you're an MCDC student, it's in your course as well. All right. Okay. So now we got some review. We have some reviewing to do. You all ready? Let's go. Of the following answers, which best describes the encounter? A, 4961522 modifier. B, 4961659 modifier. C, 4959322 modifier. And D, 4956459 modifier. A 59-year-old patient presents with a recurring 10-centimeter ventral hernia. The surgeon begins a planned ventral hernia repair. However, extensive adhesions from multiple previous abdominal surgeries significantly complicate the procedure. The surgeon spends the additional hour performing adhesiolysis before completing the repair due to the unusual difficulty and increased operative time. Wow. Okay, coders, what say you? Is it A, repair incisional ventral hernia reducible? B, repair incisional ventral hernia incarcerated or strangulated? C, repair recurrent incisional ventral hernia reducible? Or D, repair recurrent incisional ventral hernia incarcerated or strangulated? What say you? Go ahead, type your answers in the chat. All right, so I'm going to pick it up just a bit, okay? All right, so a lot of you are saying C. Let's see. All right, so here are the inventory. Just like previous in ICD-10-CM, the inventory is going to remain the same. So this patient has a large or 10-centimeter recurrent ventral hernia, and a planned ventral hernia repair took place. Patient had previous adhesions. It took an additional hour, and adhesiolysis is what took place as well. So there are 2 procedures. But in our answer selection, we've got 2 different modifiers. So I'm honing in on modifier 22. This means increased procedural services. That means that this procedure required more skill or was difficult, some level of complexity, increased complexity. And modifier 59, this means that more than one procedure took place and that procedure was distinct. It was distinct from the initial procedure. So we do have more than one procedure taking place. We do have a hernia repair and adhesiolysis. But if we keep it real, if you look at these answers, there are no multiple procedures here. So if there are no multiple procedures, then you cannot append modifier 59. Here's why. Because modifiers 59 and 51 are appended only to the second code, right? So if it's only appended to the second code on site, I know that. I always know that. So I'm always eliminating, single codes with that modifier 59. Gotta go. Now I'm left with A and C, and what's the difference between the two? And this was tough. I had to be very forensic. In my book, I couldn't see the difference between the 2 classifications of codes, but one um, family of codes is for recurrent hernias, and the other is for hernias. So the key word in our documentation is recurrent, and that keyword is also found here in C. You all saw it. So we're going to get rid of A, and the answer is C. So we will code this repair of recurrent incisional ventral hernia reducible, right? That means it's pushed back in. If the documentation doesn't specify, the default will always be reducible. But this 22 modifier really tells the story because it addresses the fact that the patient required an additional hour for this adhesiolysis to take place. Now, you might say, well, why aren't we coding it? I don't, I can't say specifically, but I can guess that this adhesiolysis is bundled. It's a separate procedure, so it's not coded additionally, and therefore this 22 modifier enables that doctor to be compensated. Let's go back. And the answer is C. Everybody good, good, good? Everybody learned something from that? Good. Let's try again. All right, good job, everyone. If you got it correct, outstanding. But if you learned something, aha, and that's priceless. All right, of the following answers, which best describes the encounter? A, 69210, B, 6921025 modifier, 99213, C, 9921325 modifier, 69210, D, 9921359 modifier, and 69210. A patient presents to the office with severe right ear pain, fever, and decreased hearing. The provider performs a medically appropriate exam diagnosing acute otitis media. During the same encounter, the provider also performs removal of impacted cerumen from the right ear using instrumentation. Okay, coders, what is the answer? I love it. You know what this is telling me? If you're able to answer this before I finish reading it, that means you have a command of the modifier. If you, I mean, or you feel comfortable answering it. If you answer it correct, that means you have a command of and understanding of that modifier. Good job. Tamara, how are you? Hi, B. Frazier. I think it's Dimitar. All right. So because time has diminished, we're going to move on. So great job, everyone, answering. Patient has severe right ear pain, fever, decreased hearing, and the doctor diagnosed the patient with otitis media. Patient also had impacted cerumen, and the physician went ahead and removed the cerumen. So I'm going to go ahead and I'm going to get rid of those diagnoses or those signs and symptoms that are integral or related to diagnoses on this list. So that's severe right ear pain, the fever, and the decreased hearing are all related to otitis media and that impacted cerumen. So that essentially that's wax. So earwax. So since they're related, they have to go. And we're just going to focus our attention on these answers, specifically these modifiers. Modifier 25, distinct E&M service. That means that this E&M service was distinctly different from the procedure. And then modifier 59, this is a distinct procedural service. In fact, 59 goes on codes that are not E&M. Let me go ahead and explain it better. Here's my gem. Modifier 25 is only appended to E&M codes, and modifier 59 is appended to non-E&M distinct procedures. So if we follow this gem, we can eliminate some things. So if modifier 25 is only appended to E&M codes, we're going to eliminate B, because if they've appended modifier 25 to the procedure. Let's go ahead and do that. And we're going to eliminate, and if modifier 59 is appended to non-E&M distinct procedures, then look at this E&M right here. I think I'm saying that wrong. I would say non-E&M codes and are distinct procedures. So let's clarify that. So these are appended to non-E&M codes. So 59 may never be on an E&M code because you got 25, right? So let's get that out of the way because 59 can't do it. And we're left with A and C. How come we're not bundling this evaluation and management into this procedure? How come? Because this leads you to your last gem. If the reason for the encounter is not the surgery, then you can code for both the visit and the surgery. I'm going to let that marinate. If the reason for the encounter is not the surgery, then you can code for the visit and the surgery. So we're coding for both, and we're going to get rid of A, and C is our answer. And you all, a lot of you got it correct, and some of you needed a little more, but you got it. And hopefully, even if you got it correct, you learned something. You got an aha moment, and that is priceless. All right, so I just want to end things on modifier that says that the modifiers, they pretty much tell the rest of the story. Anytime you put a modifier on it, it is communicating to the payer, specifically the computer system, and it's just telling you more and giving you more information that will enable you to code more efficiently. So the I did provide you with a practice sheet because I didn't have enough time to do more scenarios. So go ahead, team, if you can, go ahead and put that practice sheet, the link in the chat. And again, if you're in any of the LMS, your practice sheets are there and complete it on your own time. Also, those practice sheets were generated by chat. AI. So if there's anything wrong, bring it to our attention. Come to class and say, hey, this was wrong, that was wrong. Let me know. I didn't have a chance to kind of review it because I just made the decision at the last minute to say, hey, I want to I want to give you some more practice sheets. So I do apologize, but just know that my intention was good. In addition to that practice sheet, the modifier matrix cheat sheet is there as well. And team, if you want to give them the link, you can. Now, we only have like 4 minutes to go. If you need to leave, you can, but I have a very short discussion on HCPCS. It's really short, so we'll probably be about 10 minutes. So if you need to go, I understand. Please fill out the survey. I want to know. I need to know. And again, this is not an introductory class. This is, kind of advanced. We're talking up a little bit, trying to give you a little more tools and spark you to think about some things a little differently that will prove advantageous when you take your exam. All right, so we want to decode this HCPCS level 2. Well, what is it? Level 1, these are your CPT codes. Level 2, these are HCPCS level 2 codes. Yeah? And these HCPCS level 2 enables you to have more accurate, not only billing, but medical coding. In fact, the coding comes before the billing. Now, if you want to know the difference between level 1 and level 2, level 1, these are your procedures and services. These are CPT codes. Level 2, these are products, supplies, and services that are not in CPT. And essentially, HCPCS Level 2 codes for drugs and injections, durable medical equipment, medical supplies, prosthetics and orthotics, and ambulance services. It's more than that, but generally, as a coder taking the exam, these are the areas that you'll likely be tested on. Also, there are pretty much 4 HCPCS Level 2, no more than 4 HCPCS Level 2 questions, right? Oh, I want to go back. And I want you to know this. The primary function of a HCPCS Level 2 is to report items and services that CPT does not describe. However, there is a Medicare mandate. It is so important that you should know this too. You will be expected to know that when a comparable HCPCS Level 2 code exists, Medicare requires that a HCPCS code be used instead of a CPT code. You should memorize this rule. This rule will be tested on your exam. So if a patient is a Medicare patient, not Medicare age, but a Medicare patient, make sure that you use the comparable HCPCS code in lieu of that CPT code. All right? All right. So HCPCS codes versus CPT codes, just on site, CPT codes are what the provider does. These are 5 numbers, and this includes surgery, evaluation and management, and some administration codes. And just so you know, 96372, this is an injection code that often accompanies a HCPCS Level 2 injection code. This is the admin code, and the HCPCS Level 2 is the injection. So, but essentially, HCPCS Level 2 is what the provider uses. It's a 1 letter and 4 numbers. So the first character is always a letter and 4 numbers, but they're both 5 characters long. And essentially, you're going to be coding for things that are not CPT, like wheelchairs, saline, drugs, etc. All right. Again, just to drive it home, when you're coding for injections, it typically requires 2 codes: your admin and your product. Your admin and your product, and the patient. When you have a patient encounter, you should be coding for both. But sometimes it's going to be absent when you're taking your exam. But in the real world, you got to code for the administration, for the doctor, if you're coding for the doctor, right? And this is what a typical HCPCS Level II code looks like. There's your first character and your 4 letters. And I would say it is important to make friends with the outline of the categories. Make friends. Just, kind of study it. And here's some common these are the common categories that you're going to see. A is for your ambulance. E is for your durable medical equipment, that DME. Your J is for the injections, the J for inject with the J. These 3 are it. Now, L is your medical transportation. L is also for orthotics, and V, vision. I've never seen vision, but it could be. But orthotics, um, your injections and your drugs and injectables, and your DMEs and the medical and surgical supplies and transportation. All right. So it's just, it's really important that you understand the categories. It just is. Here are your Medicare and Medicaid codes, your GKQST, the first character. If it's one of these, it's related to Medicare or CMS. And this G code, this is where you'll see a lot of injections or admin codes, admin of medication injections, and this is something that you may see on the exam. So if the patient is a Medicare patient and a immunization is in that encounter, often that G code is somewhere in the answer. Okay. And these B codes, something you don't really see so often, but this is your enteral or parenteral, and this deals with intestine. And sometimes, you cannot eat. They have to consume their food directly to the intestine. It has to be administered to the intestine or around it. And then MPRH, this is your medical, pathology, radiology, behavioral, and health. Again, you only use these codes when applicable. When you're taking your exam, these won't be in the picture, not so much. Okay. All right. So essentially, just like CPT, HCPCS Level II modifiers help complete the story as well. You'll have your base code followed by a modifier. It can be a HCPCS Level II modifier, or it could be a CPT modifier. Either or, they are interchangeable, and it does complete the story. These are some common HCPCS Level II modifiers: LT, RT. I would say these are the most common. And of course, we talked about the digits. And this NU, this is new equipment, RR is rental equipment. And this is an example of how to apply it over here. And essentially, HCPCS level two codes, the primary driver, Medicare, CMS maintains these HCPCS Level II codes, right? And they, Medicare and Medicaid use these codes, and often for durable medical equipment, office visits, and hospital and outpatient facilities, and those injections, immunizations. And it does matter using the HCPCS Level II codes because it helps with accurate code selection, the payer policy alignment, and proper reimbursement. If you don't apply the HCPCS Level II codes, you're not going to get reimbursed, especially if the patient is Medicare or Medicaid. All right, so here is a cheat sheet for your HCPCS Level II. Let's go back. It's just a quick cheat sheet. The function of a HCPCS Level II is that it complements or supports or supplements your CPT by services by reporting those supplies, drugs, DME, and transport. Also, you can recognize it because the first character is a letter, the next 4 are numbers, and the rule is in the real world, the usage of these HCPCS Level II codes are dictated by payer policies. When a comparable code exists, Medicare mandates HCPCS over CPT, HCPCS Level II over CPT. All right. So that's pretty much it. I did cut HCPCS Level II short because of the time that we have. But coders, if you learned something, that is priceless. And just want to just kind of tell you about week 10. Now we're getting to the good stuff. We're going to be talking about procedures. And next week, we're going to talk about INTAG, right? So make sure that you complete the assignments. And if you're in the LMS, the online LMS, go ahead and complete your assignments and try and complete all before class next week so we can engage in this advanced level instruction. All right, so remember, class is not for instruction, but augmentation. Remember, you don't have to remember these guidelines, just know that they exist. Now, what you need to know, I'll tell you. Also, don't forget this Friday, we have CPT guidelines class. Not this Friday, excuse me, not this week, because MCDC, the instructors are really out this week. So we're here, but I'll let you know when the classes start, okay? Also use the Quizlet to study INTAG guidelines. Never use an encoder. It will thwart your independent coding proficiency. And never, ever use blind process of elimination. All right? So please help us help you, right? We have a survey. Please complete this survey. That's the only thing we ask. Just complete the survey. Let us know. Oh, no, no, no. We ask you to complete the survey. We ask you to like it up. Yes. And we ask you to be your best. Do your best. And we're going to do our best to help you. All right. So, team, all of the links from today are on this slide. So, if someone can put all of the links in the chat, thank you. I'll also get those links on your syllabus so you have them, but it's not on there now. So I want to make sure that you have it. And if there are any errors or mistakes, bring it to my attention. And believe me, if it wasn't vetted by us, so you might see something because it's only ChatGPT. All right. So I just want to thank you, thank you, thank you. I want to thank my team, Mr. Sandeep, Ms. Mills, Miss Haley. I want to thank my interns, Miss Beth, Miss Star Wars Girl. You all were amazing. And most important, I want to thank you, coders, for showing up and showing out every single week. So if you have any questions, put them in the survey. That's right. Hit that thumbs up on the way out. All right, everyone. Take care.
$4,000 exam passers and free classes at AMCI. Learn to code straight from home or on the road at AMCI.